dental implant is just one of the options that our patient have. Now, how do we become better at communicating our message to our patients? I think what we need to do is to take a team approach to this. According to Patrick Lencioni, that there is 5 steps to establish a successful team. The first step is to establish trust between you and your staff. And trust is one of, according to him too, is one of the most misunderstood words. Trust is not based on past performance. Trust is based on you willing to feel vulnerable, you willing to accept critique and discussion with your staff. Once you show them that will take you to the next level of communication with your staff, where we can have constructive discussion, healthy discussion, into how to improve our patient care with our patient, how to provide better service to our patient. And that healthy discussion will increase your staff commitment to whatever decision you make in your practice, will increase your staff retention, and will provide you with accountability. They will have this self-accountability and peer accountability because they know that they will be held to the same standard that you are going to be held to. And why do we do all this? Because we focus on our result. From my personal experience with taking the team approach to provide dental care to my patient, I took myself from 2008 to 2012 in Brooklyn Center, and you all know Brooklyn Center is not that high-end population. It's a great place, but always there's financial challenges and other issues that we have to talk to our patient. To take a team approach to this, I was able to double my production. I think once we do those steps, it will show the result. There are many reasons why implant can be the best choice for our patients. These are just few that I took from the American Dental Academy of Implant Dentistry, which I had most of my education in implant through taking the Maxi course in Las Vegas, which was run by John Beneshati, who is the president of the American Academy of Implant Dentistry right now. And also was taken from the International Team of Implantology website and from our website that John, decent oral hygiene, decent systemic health, sufficient space, and this is important. You have to make sure that you have enough space, not just for the crown itself, but also for the root of the tooth. If you go Monday morning, you look at your charts, any patient that have a missing tooth, any patient that had a failing bridge, any patient that have an existing partial or a full denture, or a failing root canal, all those are candidates for an implant in addition to any patient with a compromised tooth because of decay or because of periodontal reasons. You can't say no to this, can you?
No, you can't.
So we're going to take a team approach, as I said. Once you establish that functional team and you establish the trust between you and your staff, and you have this open discussion about how we can improve our patient care, your staff are committed to your recommendation, and they hold themselves accountable for anything you say or any standard that you set. Now it is time to see how we can apply all this to communicate our message through teamwork to our patient. What you need to do as a leader for that team, when the team is defined as your hygienist, your assistants, and your front desk, and you need to set clarity. You need to set clear expectation and standard and values with your staff about your practice. So my expectation from my hygienists that have to do certain things, my expectation from my assistant to do certain things, they don't have to come back to me because they know what are the standards. And I always try to adhere, make it like it's not just my standards, Metro Dental Care standards, it's our standards. So because we work as a team. And then the most important step in being successful once you have that team is to communicate and over-communicate this message to your staff and to your patient. And I'm going to show you how we can do that. That will increase your patient commitment, as I said, and hygiene department. I think this is the most important department in my team, because I have really high expectation from those hygienists. Starting from the time of the huddle, they will screen all the patients that have missing teeth, unfinished treatment, or potential treatment. They will identify that. They will also talk to their patient about those missing teeth even before I come to the treatment room. And they say, Mr. Jones, there's this tooth that is missing. Did you think about that? Or what's your thought about it? And then they can talk in general, what are the options? And then they close their statement by saying, Dr. Ismail will come and probably talk to you about this. So they are prepared for this. So they heard it now once. And then when I come to the treatment room and discuss the treatment option with the patient, they will hear it the second time. But before that even, when I was doing the exam, they will hear that conversation between me and my hygienist. So this is the second time, and then I will talk to them about it. This is the third time. Then I will leave the room. My hygienist will just reinforce the same thing I said it for the fourth time. This is what I'm saying, communicating and over-communicating the same message to the patient. Because they say, on average, you need to hear the truth 6 times to believe it. We're doing about 5 times now. This is 4 times, and once my hygienist discuss the information with the patient and add to it the cost, which we had template in EDR that I'll discuss in a little bit, she will hand that patient to the front desk. They will just have to present that treatment plan on paper because they had all the clinical discussion before. And then they will just have, I know a lot of us feel that I don't like to sell treatment, but I feel that our patient, we have a responsibility to present the treatment option to our patients. It's not about the money, it's about the service itself. If I have my hand cut off, God forbid, and I'm walking to my doctor, and there is multiple options. There is one, he will say, there's an option where you have a metal hook, you can still drink your coffee, works great, it's covered by your insurance. If there is an option where you have a natural tooth that can feel and work like your natural tooth, your natural hand, I want to know this option. I don't want my doctor to assume that I cannot afford this option because I wear like a construction outfit, or I don't want my doctor to make any assumption. I want them to provide this option to me. In fact, I want things as doctor that we really have to try to do. First, facial expression. I think there is research that show that when you first meet someone, the first 10 seconds are very important in making a decision about your personality. So that first 10 or 15 seconds you want to use by your facial expression, by a smile. If you work in a busy practice like the one that I worked in Brooklyn Center, you may think I don't have time, I'm running behind. The truth is you cannot afford not to build that relationship. Always start with something positive. Because sometimes if you start with someone and say, you have a terrible teeth, you lose that person. I mean, we'll never say that, of course. But you want to start with something positive because that forces your patient to, they want to listen to you what you have to say. You have a beautiful smile. Now they are interested. Yeah, what about my beautiful smile? Yeah, you can make, and as I say, join an organization that help you to grow. This was in 2012, my graduation, the fellowship with the American Academy of General Dentistry. Spent 5 years, great time, learned a lot. So I encourage you all to attend something like this. And this is, I love the nature as I say that. This is, I had this slide there, this is me. You can see me happy there. And this is because I want to say about taking risk. If you have a good team like mine that all battle in the same direction and at the same rhythm, you're going to be successful and going to have fun. Thank you very much.